Hello, everybody. Welcome to another Zoom call. We're going to get started right away. A bunch of questions came in. Reminder to everybody that's new, always check the member site. I can't believe how many people we talk to on a weekly basis that have never been on the member site or never go on the member site. Obviously, it's not you guys because you're on the Zoom call, but I don't know. I mean, it's included in your plan. So, I mean, is an opportunity for you to learn something, I think. I don't know. But all the announcements will be on there. Know that you get a 5% subscription savings if you subscribe. It's like a subscribe and save on Amazon to a supplements. If you need to order orthomolecular, if you can't find something on there, orthomolecular, biotic, and Apex do not allow us to have the supplements visible online anymore. They don't allow anybody to. And the companies that do are violating their principles, and we don't want to violate their principles. So, and if you need a educational call or call with me, talk to me, please fill out the form online. And when you do the cheek swab, please fill out a form online. So the forms look like this. They're right under the educational coaching call section on the member site homepage and other pages as well. Remember, also you have access to all the courses that we have and access to all the blog posts. So if you're looking for something, there's almost 1,000 blog posts. You might find the answer there. Can you tell me your thoughts on LDN, low dose naltrexone? Could it be combined with mistletoe? So low dose naltrexone is an off-label use of the drug naltrexone. Naltrexone was approved at, I think it was 50 milligrams for people getting off of heavy drugs like morphine. Naltrexone is used to help get people off of drugs like morphine, street drugs, people that are addicted to drugs. But that's at 50 milligrams. Someone, I don't know who it was, I don't remember the story, that found that using it in very low dose, starting at 1.5 milligrams, going up to 3 milligrams, and then up to the maximum of 4.5 milligrams, it's called low dose naltrexone. So they're using it off label. When you use a drug off label, you're using it for something that it wasn't technically approved of by the FDA. So if it wasn't approved by the FDA for that, you're using it off label, meaning for some other thing. Low dose naltrexone has been used for autoimmune diseases because it tends to be an immune balancer or an immune regulator, or what's called a T cell regulator. It acts as stimulating what are called Treg cells. So when a person is autoimmune and their immune system is flared against something, with autoimmune, it's flared against self tissue, then low dose naltrexone can calm that down. Now, there's been some alternative doctors that have used low dose naltrexone for cancer, which I don't know. To me, I struggle with understanding the pathways with that, because it really acts like a T regulator and you really want to stimulate the immune system. That's the whole idea of mistletoe therapy. Mistletoe therapy is an immune irritant. That's how it works. As an immune irritant, it's firing a hyperimmune response. And then, with that hyper T cell stimulation, you're going to possibly kill more cancer cells. So I don't know why you would use low dose naltrexone combined with mistletoe. To me, it's kind of counterproductive. So I would ask the doctor, if they're prescribing this, why they would prescribe it that way. I'm not quite sure. That seems counterproductive. Do you think there would be positive results with my breast cancer? With mistletoe, for sure, that's possible. With low dose naltrexone, no. We have used we've had people on low dose naltrexone with autoimmune disease. I haven't really recommended it. Of course, I don't recommend it because it is a drug, but I wouldn't really necessarily think it would be a good fit for cancer. Even though I know that there's some alternative cancer doctors that do use it. Of course, that's not the only thing that they're using. So I'd question whether that is really the thing that's helping the person. I don't know. What do you think of ivermectin as a treatment and a tool for the prevention of COVID? Well, I'm very much in favor of that. And you can't argue with the possible benefits of ivermectin. There's been multiple research articles for ivermectin and cancer as well. So ivermectin is similar but different than fenbendazole. And both of those have been shown to help people with cancer. Certainly ivermectin has been shown to help people with COVID, long haul COVID, and especially acute COVID, and preventative for COVID. So I think it's a great use, again, an off-label use of a drug. Is there any other way to clean the ion ProWave other than the muriatic acid that is recommended by TrueRife? It is toxic, and since we live in an apartment, there's no healthy way to use it. Yeah, I understand that, and I understand that that's a problem. To be honest, I would like to see a raise of hands of every one of our patients that uses the ion ProWave on a regular basis and that actually do clean it. I would suspect it's probably less than half the people. We've had people that have used it and up to 80 times and have never cleaned it once. Now, the cleaning of it is probably more necessary for people with maybe dirtier water. I haven't done any investigation on it. I don't know if people with chlorine and fluoride in their water, mainly, regular city water, or buildup on the ion ProWave plates, or people that are using it in more rural setting with more harder water, like for well water or something. Ed says, I just rinse the ion ProWave with hot water and never use muriatic acid over a year. Yeah, I would guess that more people fall in Ed's category 2, that they're not using the muriatic acid. But we have had some people that have had issues with their ion ProWave, and I think it has to do with the hardness of their water or something, because they had buildup quite quickly on it. I clean my monthly on well water with a softener. You going on 18 months now. Okay, so are you cleaning it with muriatic acid, Patty, or are you cleaning it just with your well water, rinsing it like Ed is? Oh, with the acid. Okay. Okay. So we'll come back to Mark's question. Well, this ties to the low dose naltrexone. That was me using the low dose naltrexone. I started at 1 milligram February, and now as of today, I just went to 3 milligrams, maximum 4.5. LDH is lower by a lot, and inflammation much lower with Rife. So I would, I think the pathway there is, if the person has chronic inflammation from some other source, using low dose naltrexone can calm that down, and that could possibly. So going back to this question here again. So if you're going to use low dose naltrexone with mistletoe, I would say spread them out. If you're doing mistletoe injections, every day, then maybe at the 12-hour point, then use the low dose naltrexone. Typically, low dose naltrexone is dosed at night before you go to bed anyhow. So if you're doing the mistletoe in the morning to stimulate an immune response, and you're using the low dose naltrexone to kind of clear out the inflammation at the end of the day, then I guess it makes sense that. And I could see the efficacy of that, especially if your cancer is tied to some chronic inflammatory source in the beginning. Then I could see that how you could tie that together, and you could make a case for that. I'll be meeting with an endocrinologist concerning a spot on my thyroid that was shown to be cancerous 3 years ago, and now a new spot has been seen on a PET scan. What are some questions or tests that I can ask for with this doctor? I want to avoid the removal of my thyroid. Well, I would ask questions like, how big is the spot? Can we keep an eye on it? And do another test in 3 months? If they're solely going on the PET scan for saying that this is another cancerous spot, are they going to plan on doing a biopsy? What's the plan of attack with this? Can you see the spot on an ultrasound? Can you see the spot on a CT? Can you see the spot on an MRI? How big is this? How big is the tumorous area that they think is cancer? All those kind of questions. I would also run some tumor marker tests to see if there's any other tests that are going to give you some objective data on what's going on. Again, just like anything else, you don't ever want to just rely on one test to make a life-changing decision. Can candida cause cancer? Well, anything that can enter into your cell and affect the nucleus and interrupt the replication cycle can be a cause of cancer. So yes, I guess it can. In our testing, have we seen that? Maybe a few times, but if you on the rare side. What herbs or IV treatment is good for candida? How would berberine be good for cancer? Thank you. So I pulled up the product label for the Candicin Forte, which is a product that we use a lot with candida. That's an orthomolecular product. And just to show you what is in there that has been shown through different studies that can be helpful for candida. Berberine is one thing on this list that can be very helpful for candida. What else is berberine good for? Well, berberine is really good to lower your glucose levels. So somebody who has cancer, who's trying to keep a lower blood glucose level, berberine is really good. Somebody that has elevated glucose levels due to, pre-diabetes or diabetes, type 2 diabetes, using berberine can be really good. What else is berberine good for? Berberine is the best killer for H. pylori. What's H. pylori? Helicobacter pylori is the #1 gut infection that is 100% times occurrence out of all the ulcerative intestinal ulcerations like stomach ulcers and duodenal ulcers, 100% of the time it's caused by H. pylori overgrowth. Also, about 1/4 of the heart disease and coronary artery disease issues are caused by Helicobacter pylori. So dealing with a chronic Helicobacter pylori infection is important. So that's why I've told you in these Zoom calls over the years that I take berberine not every day, but I take it every month. I'll take it for about a week, just because I have a history in my family of heart issues, and berberine is something that's really good for that. So anybody that has a history of heart issues, history of candida, history of gut infections, parasitic infections, history of stomach ulcer, berberine is a good cancer killer in a sense of that it can kill a cause of a cancer if it's parasitic or bacterial related. And secondly, it can help decrease blood glucose levels, which is always good for a cancer patient. So berberine is really good for a lot of things. It's one of my favorite supplements. Oregano leaf, caprylic acid, cinnamon, and other things on this list are good for candida. I've been having some sleep issues lately. I take the Entourage. So the Entourage, for those who don't know it, that's CBD. That's a CBD product. It does not have any THC. It's just CBD. at night, and this only helps for a couple hours. So CBD, why would that help with sleeping? Because it can really decrease inflammation in the brain, and it can decrease glutamates in the brain. So that's why it can help with sleeping. I tried Insomnitol, and that did not help either. So Insomnitol is a product from Designs for Health that has melatonin in it, and passion flower, and chamomile, and some other herbs that can be relaxing. Do you have a melatonin that you would recommend I do? I need to wait, or should I wait till another cheek swab? Any suggestions? So if the Insomnitol didn't work at a higher dosage, then just melatonin probably will be helpful for you. So whenever you have sleeping issues, you do want to dig to, whenever you have any issues, you want to try to dig to why. I mean, it's not like you have a deficiency in, passion flower herb, or you have a deficiency in CBD or something like that. So what could be a cause of sleeping issues? So if you can't fall asleep, so what helps you fall asleep is melatonin, is the release of melatonin by the pineal gland, and the pineal gland stores melatonin and releases it when there is a loss of light. So if you have the habit of laying in bed and staring at your phone, or watching TV or something like that, you aren't decreasing the light to the brain and stimulating the release of melatonin from the pineal gland by doing that. So that's counterproductive. So that can be an issue. So make sure that you are going to bed when it gets dark out, closing the shades, getting blackout curtains if you have to, see if that will help. The other reason why you might have issues falling asleep is because you have excess glutamate in the brain. So glutamate is a neurotransmitter that's excitatory, stimulates the brain, wakes you up in the morning. Glutamate is necessary. So it's not a bad thing, but excess glutamate is a problem. So look for glutamates in your diet. Are you eating any processed foods that have glutamates in it? That's what monosodium glutamate is. That's a glutamate that stimulates excitatory transmission in the brain. That's why they put it in food, because it just revs up your brain, and you go, whoa, this is really good. And it's just because you have a brain stimulation when you eat that food. It has nothing to do with taste. So it's a taste enhancer because it acts on the brain, not because it's not because it's actually enhancing the taste. So glutamates are produced in your body through a breakdown of glutamine, which is an amino acid that's found in any kind of protein. So excess glutamine can be bad for cancer patients, because glutamine can be a feeder of cancer. But glutamine will break down to glutamate, especially if you have a lot of genetic defects on your GAD gene, your GAD gene pathways. So you'll break down glutamine to glutamate quite quickly, and you'll have an excess of glutamate. So people that have OCD and anxiety and issues, and are ADD, ADHD, typically have GAD defects, and they break down glutamine, any protein that they eat, into glutamate. I have that. That's why I talk so fast. So, and those people tend, to be quick thinkers and things, but sometimes they have more difficulty falling asleep. So you have to take, precaution with that. Like, don't, cut down on the protein, before bedtime, things like that. So of course, if that's the issue. Another issue could be that I fall asleep, but then I wake up and I can't go back to sleep again. That is typically a cortisol issue. Cortisol is a hormone that's released and made by the adrenal glands. So that's a totally different issue. So one test that's good to run is the Dutch Complete test, because that does test for cortisol balance as well as other hormones. That's something that we can look at and see where your cortisol balance is. So there's a lot of things to look at when a person says they have sleep issue. There could be a lot of reasons because of that. Not to mention just stress issues, that you're thinking about too many things. I mean, there's just tons of techniques that you can work on to try to decrease your stress. Go for a walk before you go to bed. That will help burn glutamine and glutamates, and just calm you out. Getting outside before you go to bed, that will just help calm you. And we haven't even begun to talk about light stimulation from computers. I'm sitting here looking at a computer screens, any screen, your television, your telephone is vibrating at a frequency of 60 hertz, which is, with a high, super high beta wave. And a normal beta wave, meaning that awake and alert wave that your brain functions at, is about 28 to 32 hertz. So you're stimulating your brain at a hyper wave. You have to get down, your brain has to get down to a theta wave, which is about 10 hertz in order for you to fall asleep. So if you are used to watching TV or looking at your phone, you're firing your brain at 60 hertz. It's really hard to get it down to a theta wave for you to get to fall asleep. So one other thing is, could you help you if THC is available in your area legally? That can help you relax and fall asleep. There's other reasons that you could be awake if you have pain issues, things like that. THC could be helpful for that. So really, it's such an individual thing. In recent weeks, you posted why it might be unwise to do a water fast only with cancer. I tended to search through previous videos. So the reason why you don't want to do, so the real thing is that you don't want to do a water fast greater than 24 or more hours. And the reason is that it increases IGF-1 levels. So a water fast of greater than 24 hours increases IGF-1. And that's the key. So you don't want to increase IGF-1. That's part of your growth factor family. Now we have patients and maybe people that have been on this that have done a 12-day water fast, and that they feel like that really helped turn their cancer around. And so I'm just saying this isn't a hard and fast rule, it's a general rule. So if a person wants to do fasting and they really feel led to do fasting, you can do fasting. It will increase IGF-1 levels, but there is other benefits from that too. It'll certainly decrease glucose levels. So there can be benefits to that. You can get just as, nearly as good benefits from time restricted eating. That's why we recommend that so heavily, meaning that you're only eating within a window of maybe, cutting it down to 3 hours a day. I'm only eating between 3 and 6 in the afternoon, and that's all the time I'm really doing my feeding cycle, and the rest of the time I'm fasting. So you could get just as good a benefits, one could argue, doing that than doing a long 10-day fast or something like that. So consider that. Is there a way to index topics on our weekly videos? We have talked about this as a team many times. We actually have had someone work for us that have been cutting up the videos into smaller videos. That's where you see a lot of the smaller videos on the course, on the member site, I think on the Rife page of the member site. It's just very time consuming for us to do that, and costly for us to do that. We're trying to figure out, Dustin is working on some way with AI to be able to use AI to our advantage to help do some sort of video indexing. So thank you for that. I noticed the last few times I did the Right Foot Bath program, I experienced extreme fatigue. We've heard this before, that I was just absolutely wiped after doing the foot bath. I had to lay down. I just couldn't do anything the rest of the day. I hope this is a good thing. Eating something helps too. As often as I've been doing the intermittent fasting, I noticed this, not by intention. That said, I often experience being tired with foot bath programs in general, but never this much. It can be because you're hitting those higher frequencies. It can be because it's stimulating detoxification, and you're getting more of like a Herxheimer type reaction. So I think when you're doing frequencies and you notice that some sort of symptom pattern like this, I think that is a good thing as long as you can tolerate it. Yes, I'm not vaccinated, at least with the mRNA vaccine. Okay, that's good. I did one round of Keytruda and did just fine with minimal side effects. They decided to spread out my treatments and give me a double dose for round 2. Ugh. This gave me extreme fatigue and Bell's palsy. That's not good. So Bell's palsy is a cranial nerve 7 facial nerve palsy. Talk about that in just a second. Which they say is temporary, and the steroids seem to be helping. I know you cannot tell me what to do either way. I'd love your opinion. But I'll just tell you right now, I can't tell you what to do with drugs. I know you have to do what your oncologist is asking you to do, but I'm not in favor of doing a double dose of any type of immunotherapy or chemotherapy. Thinking that, oh, we'll just hit it double, we're going to skip one and do a double dose this time. To me, that is just downright dangerous. I just don't understand their thought process with that. Bell's palsy can happen when you have any type of inflammation. This is cranial nerve 7. It comes out of the base of the skull, and it's the facial nerve. So typically it'll be on one side and you'll get a complete drop of your face. And it's typically, so if a person has Bell's palsy and they had no precipitating issue like condition like cancer and using a chemotherapy or immunotherapy that would have stimulated it, typically Bell's palsy it can be from a virus, can be from stressful incident, can be from attributed to cervical spine malalignment, subluxation. And one of the things that you need to do is stimulate that nerve, because you do not want that nerve to die. So I used to see Bell's palsy patients in my office. You want to take a brush, like a fingernail brush, a coarse brush that you'd scrub your fingernails with, and you want to push it onto your skin and stimulate your skin. You need to stimulate that facial nerve. You can't let that facial nerve die. The longer that you have Bell's palsy, the more impossible it is to fix Bell's palsy. If a person came in with Bell's palsy that they just noticed the effects of it just a few days or a week previous, we can always 100% get them back to normal. If it was weeks or months, and they've been having this Bell's palsy, then it made it more difficult because the nerve ends up necrosing. So you have to stimulate that nerve. So I used to teach people to stimulate that nerve using a brush, using hot and cold water, getting adjusted. I would go to the chiropractor and get adjusted, make sure they do low force technique given your condition. Do everything you can to stimulate that nerve. And the reason why the steroid is helping is because it's anti-inflammatory. So you have inflammation of that nerve. So you want to keep that nerve awake and alive. I'm still on a feeding tube, so even crush pills are hard to get through. Are there any liquid supplements you'd suggest to help? I would definitely be on high dose curcumin with Bell's palsy. And that is the liquid liposomal Curcuclear. You could use that. That's a liquid. If you're mixing up your drinks, like the greens and different things like that, into a smoothie, you can water them down really good so that you can use that. Any other liquid? So I'd have to give that some thought. Maybe we should have a conversation. Would you suggest to take a break from ivermectin for longer than a few days? Not sure the lymph nodes in my neck. Didn't know if they would need to catch up detoxing for any reason. Doctor doesn't seem too alarmed yet about them. I don't know. I mean, I certainly know, there's lots of people that have been taking ivermectin daily for the last 4 years and with no ill effects. I don't think you need to take a break from ivermectin. 3 separate hospital oncology departments have now recommended radiation and chemotherapy as a treatment combination that they would employ to fight my head and neck cancer, which has been classified as stage 2, though the radiologist considers it stage 3 due to the tumor sizes and the number of lymph nodes it's in. Tumor board meets tomorrow, but it's looking like weekly weekday radiation and high dose cisplatin weekly for 7 weeks. If I knew of another course of healing for these tumors, I would consider following that course, but I don't. Remember, you are doing a lot of things, and doing the things that you're doing, if the cancer is continuing to grow, if you're doing everything you possibly can and the tumors continue to grow, then using a harsher course of care may be the right thing. Doesn't mean you have to do everything that they're telling you to do, meaning the entire course of 7 weeks. Maybe you're only going to do 2-3 rounds of it, and you feel like it's shrinking and doing well, and you feel like God is leading you to step back from that, then that's your choice. So you don't have to do the full course that they're saying. And I would ask them to see, is it progressing? That's the biggest thing. I had to keep these small as it wouldn't fit on the page. Is there any other alternative course you'd recommend? The tumors are affecting my swallowing and speech and could affect my airway at some point. We have other people, I don't think they're on tonight's call, that have this same type of cancer, that have head issues and a fear of that it's going to affect their airway. And some have chosen to do some radiation and some chemo, and it helped. And they're done with that, and they did well through it. So don't be afraid to do that. Just make the decision based upon wisdom and based upon prayer. And when I say wisdom, I mean, okay, let's just be wise about it. If it's progressing with everything you're doing, then maybe it is wise to at least consider prayerfully to do some of the quote unquote bigger guns that nobody wants to do. But using that can knock it down with everything that you're doing. If you must go this course, are there things that I might request or negotiate to make it less harmful? Not really for them. There's not going to be anything that they're going to be able to do to make it less harmful. But you should have a conversation with me. We should talk about if there is anything that we want to do from a nutritional standpoint. Meaning, like we do on our blog, you can see we do have, if you search this for chemo protocol, we have a chemo protocol on there. And I think it's on the member site as well, that it typically recommends that you go off of all your antioxidants for a period of time, 48 hours after the administration of chemo, and then you could go back on them, and that you do a 24-hour fast prior to the administration of chemo. That, of course, means that if you're doing an IV chemo therapy. So if you're doing chemotherapy at 9 o'clock Monday morning, you'd start fasting at 9 o'clock Sunday morning before chemo, and then you would go off of any antioxidant nutrition, and we can help you identify what that is in your protocol, and you'd go off of that for 48 hours, so you wouldn't go back onto that until Wednesday sometime afternoon. What steps should I take during minimize damage. So this is what we're talking about. What steps should I take after radiation and chemo to facilitate detoxification? So during, again, you'd go off of antioxidants for 48 hours, because that's really when the chemo is doing its main work. Remember, chemo is an oxidizing agent, so you don't want to negate the effects of chemo if you're going to do chemo. And after you're done with radiation is also an oxidizing agent. And when you're done with radiation and when you're done with after 48 hours of chemo, then you can hit hard the antioxidants to pull that stuff out of your body. I went vegan this winter and dropped unintentionally 20 pounds. I'm 5'110". I'm trying to gain weight. If I do chemo and radiation, what kind of nutritional strategy should I employ during the treatments to avoid losing any more weight? And a feeding tube has been recommended. A feeding tube I would only recommend if you need the feeding tube, like you can't swallow. They're thinking because it's head and neck cancer and the radiation is, you might end up with such a painful throat that you won't want to eat. And it's going to be hard to get you to eat because it's going to be painful. Then you do not want to lose weight. You don't have weight to lose. So you may have to consider getting a feeding tube to get the calories so you don't lose weight. There has been quite some difficulty in getting my new hospital record sent to you. Have you received my biopsy? We did get something today. I haven't had a chance to look at them. But if so, look at them. If you want to set up a time to go over them, just call Maureen. Okay, I missed some questions here. Talked about that, did that. Do you know about Mark Sloan's book about methylene blue? What do you think about using methylene blue for treating cancer? I haven't read his book. I've read some of Mercola's information about methylene blue. I know he uses methylene blue. He was one of his, I think, pieces of his protocol for COVID. And it makes sense for killing the viruses and bacteria. I have not heard about it using it for cancer. Would Hashimoto's be an inflammatory? Would Hashimoto's be an inflammatory with low dose naltrexone? This was suggested by my functional doctor that helps with my thyroid. So Hashimoto disease is autoimmune disease of the thyroid. And yes, any autoimmune disease is inflammatory or will have episodes of inflammation. And yes, low dose naltrexone could be very commonly something that would be used for Hashimoto's, yes. I have metastasized prostate cancer. What do you think of cryoablation? So, yeah, using cryoablation, that is depending on what you're talking about, what area, is it just of the prostate? We've had people that have done that with great success. So that's not anything that we do. So I can't give you a lot of comments on that. And it's not something that we've had done, had people do a lot. So, but I do know they've had a lot of success with it. I find information in the membership regarding using hydrogen peroxide for oxygenation, but it did not open. Can we start with 1 drop and go up food grade? No, I am not a big fan of using hydrogen peroxide for cancer. And I do, let me pull up our site here because I'm pretty sure I have a blog post on that. Let me make sure it's live real quick. Yeah, hydrogen peroxide for cancer. So if you just search the blog hydrogen peroxide for cancer, it's called hydrogen peroxide for cancer, not so fast. And there's a YouTube video that is not linked. So that's what you're talking about. So let me look. We actually had several YouTube videos taken down by YouTube because they were I guess I don't know, probably racist or something. So, but yeah, they just one yesterday. They said we pulled your YouTube video because of something. Okay, so I will fix that link for you real quick, and then you can look at it. So I'll just go back to that blog post in a couple minutes, and then you will be able to see it. Here, I fix it. Okay, after my genetic test, I had a histamine issue. You had suggested histamine scavenger. I seem to get amped up on it. Yeah, we talked about that a couple times ago. That's why I stopped. I know the store has HistaClear and a DAO enzyme. Will this work as good also? Another is natural clear hist. This one has quercetin. Would this work? So there's a difference between clear histamine scavenger and natural clear hist. And the difference is just in the ingredients of the products, but the natural clear hist and the histamine scavenger have the same principle. They're helping pull histamine out of the tissue. The HistaClear is a DAO enzyme. So the DAO enzyme is the purpose of that is to help break down histamine in the gut. So the DAO enzyme isn't well absorbed. So it really is just working in the gut. So it is not working beyond really the gut. So if you have an issue beyond the gut, meaning you're trying to pull histamine out of the tissue, then you have to use clear histamine scavenger or histamine scavenger or the natural clear hist. And the reason why we have them both private labeled is because they have different ingredients in them. And some people do really well in the histamine scavenger, and the natural clear hist doesn't really do a lot. And some people do better on the natural clear hist. So just gotta try those and see the difference of those. That's really the only thing that you can do with that. That DAO enzyme is for people who really have a lot of gut inflammation or their histamine issues are more related to inflammation in the gut because of maybe food sensitivities, because of inflammatory bowel, because of it's histamines in their diet. That's the issue. And then they would use the HistaClear, the DAO enzyme. So there are 3 different products. 2 of them, the histamine scavenger and the natural clear hist, are working to pull histamine out of the tissue. Also, there's another one called ABP1 Assist that helps pull histamine out of the tissue. Those are 3 different products that can be good to help pull histamine out of the tissue. And the HistaClear is the DAO enzyme that really helps break down histamine in the gut. Okay, I have a Dutch test at home. I started back on letrozole at the same time I received the test, so we decided to wait. Let me know if this would be a good time to do the test. It's been 5 weeks or so on the letrozole. Yes, I'd say that's fine. Really, letrozole really starts to work right away. So you could go on that. Yeah, you could definitely run that. I was talking to Alan Goldham at True North, and he asked, okay, I didn't get the rest of the question. He asked, I don't know what he asked. So if you could clarify that, or was it the question that you asked before? Okay, I did fix that link, that YouTube link for hydrogen peroxide and cancer, and you can watch that to get more details on why I would maybe not recommend it. The tumor on my right breast stopped bleeding with the castor oil on the bandage. And that's good news, and that helps answer the question that a few weeks ago somebody had about using castor oil on their breast tumor. It then pulled out a fungus from the tumor. You suggested spraying hydrogen peroxide on the tumor under the castor oil. Yeah, so that'd be different than taking hydrogen peroxide orally. You're using it as a topical antiseptic. So that's where it's beneficial. So hydrogen peroxide is H2O2, readily gives off that extra oxygen to kill a bacteria or a virus or a pathogen topically. And that's where hydrogen peroxide orally can be beneficial if you have like H. pylori in the stomach or a bacterial infection in the stomach or in the duodenum. But beyond that, it can have other negative issues. It can actually be an oxidant that can damage cells and could be a cause of cancer. So, but using it topically, hydrogen peroxide is just how you use things. This helped with the fungus, but then the bleeding started again. I'm trying to stabilize the bleeding so I can heal on the inside out. Any suggestions? The other thing you can use as a topical antiseptic is colloidal silver. So that's another thing that you could use as a topical antiseptic. You can also make your own with maybe an oil mixed with an essential oil, because you do want to use like something like oregano oil straight. I mean, that would be burning horribly, but you could maybe mix it with an oil, so you could use that. For Tony's Bell palsy, where exactly on his face would he brush? You could look up a graphic of the facial nerve on Google, and you could kind of see that nerve, and you want to brush along that nerve pathway. It goes up to the temple area. So you're brushing on the temple area, and you could use your hands to scratch on it. The noise you hear is me scratching in my temple. So I want people to be stimulating that nerve constantly, waking up that nerve, stimulating that nerve constantly. Question about circulating tumor cells. I've been told they continue to be in your body for the duration of your life. It's just a matter of monitoring. Are they inactive cells, active cells, stem cells? I know the RGCC looks at them, but do cancer marker tests also track them? So cancer marker tests do not track circulating tumor cells. Cancer markers themselves are different enzymes that are given off by a lot of different cells, not just cancer cells. So that's why there's a normal range of tumor markers. So the normal range of a CA15-3 is, I don't know, 0 to 35, meaning you could not have cancer and you could have a CA15-3 of 15. Well, why would that be? Because they're not specific to cancer. Other cells give those off too. Circulating tumor cells are cancer stem cells, so they're not yet in a rapid replication phase. It is disputable that you have circulating tumor cells the rest of your life. I would argue that the chance of a person, who had a diagnosis of cancer having circulating tumor cells that are still alive, but maybe not in rapid replication somewhere in the body is quite possible and highly probable. So you should be always doing things to keep your cancer at bay. I've heard too many stories of throw along my 25 years of helping people with cancer, of people thinking that they've cured their disease, that they stop using the Rife, or they stop doing it, all the stuff that got them to the point of good spot with their cancer, and then the cancer, quote unquote, comes back with a vengeance. Well, it's because it never was totally gone. There was circulating tumor cells. That's why I disagree, and you've heard me say this 100 times, with an oncologist saying you have no evidence of disease. Well, that's actually a better terminology, which is a new term, versus saying that you're cured, you don't have cancer anymore, or something like that. You should always say that you're in remission, you're doing well, keep doing what you're doing to keep yourself there. That's my point of view. I'm thinking of taking artemisinin for metastatic bone cancer. This is in the store. What would be your opinion of which one to use? I would use the artemisinin solo. We used to use the artemisinin. Well, we have several artemisinins. The artemisinin solo by Research Nutritional. It's a white bottle with a yellow label. I think is a really clean product. It's called artemisinin solo. I know others who have had cancer and have killed it, and just do not know how to supplement to use. I would use that one. Artemisinin is, I haven't talked about artemisinin for a long time. It's a great product for bacteria as well. Matter of fact, it is kind of a bush that grows, like a shrub, and it is native to Africa in multiple different areas. Artemisinin annua, the name of the plant, and it will kill all sorts of different diseases. It is great for Lyme disease as well, and it can be very helpful for cancer patients. I watched the hydroperoxide video today. Okay, good. I was on ivermectin through another practitioner this winter. I tolerated it well until she doubled the dose, and I broke out in a 3-week itchy rash that stopped the ivermectin. Could this be good to be back on it for me, though a lower dose? Certainly, it can be. With anything you can take too much, you can overwhelm your pathways. If you broke out in an itchy rash, I know somebody else, and you're having issues with an itchy rash, I would like to know how that is going for you too. It can be just because you're just kind of overwhelming your body. You can't, sometimes you need to take a break from something. Ivermectin is a drug, and you have to detoxify it. So that could be the issue. Oh, that was about fasting, the other person. Okay, good. I will set up a call with Ray to go over my situation this week. Thanks for your help. Absolutely. We know sugar from alcohol can feed cancer cells, but we know that red wine can be an antioxidant. Right. So we should all drink at least 2 bottles of wine a day. No, I'm just kidding. But yeah, you can't argue the fact that a good, clean wine can be beneficial. There's a story circulating around Instagram right now about somebody did a little short video on the guy who had terminal lung cancer that he was given just months to live, and told him he had to go on chemotherapy and stuff, and he decided, forget it, I'm going to move back to my hometown, which is a Greek island in the Mediterranean. He moved back to that Greek island just to die, and he ended up living another 20 years or something like that. Crazy story. I've talked about that story years ago. I think Mike even wrote about his story in my book. I don't remember. And he drank wine every day, and just totally clean living, all organic food, zero stress. All sorts of things contribute to one's healing. So everything within moderation is the right way to go. For what it's worth, I have had success with the hydroperoxide topically with squamous cell skin cancer, carefully with a Q-tip, and 35% food grade on the scab. And with 3% just sprayed on as well. Surprised how well it worked. Yes. Because really it's actually working as an oxidizing agent. So it can kill topically like that. My issue with it is that, you think, oh, well, then it's going to work orally. I'm going to take it and it's going to go right to my cancer and work as an oxidizing agent to my cancer. No, it's not. It's going to break down in your stomach. And if you don't have cancer in your stomach or any bacteria to kill in your stomach, it's going to kill your gut flora, and it could be an oxidizing agent that could cause cancer in your stomach or your intestines and such. So, but if you're putting it directly on the cancer, that's a totally different story. So it's like doing your own homemade chemotherapy in a sense. All the tumors and affected lymph nodes are on the left side of my throat and neck. Nothing showing up anywhere else on the recent PET scan and CT scans. The radiologist plans to radiate my right side as well as far reaching around the tumors, etc. When I asked why and could he keep it more localized, he said no, that it would be a disservice to me and he would not. If I did choose to cut the treatments short, as you just recommended, as you just mentioned, he might be doing other areas before necessary areas and would have no say in it at first. This is why you might need to ask around and talk to a radiologist or radiology oncologist who will work with you and do what you want to do. And he or she may actually give you some valid reasons why they want to do it a different way. But more often than not, they want to do it a certain way because that's what's dictated to them. And if they do it a different way, meaning a way that you may want it to do, it may even makes more sense. Like, why don't you just do the spots that have the cancer? Well, then they're liable for not following protocol. And if they don't follow protocol and you have a poor outcome, you could sue them. Most of the stuff that's done in the practice of medicine today is avoiding a lawsuit. And how they avoid a lawsuit is, if they give you chemotherapy and the chemotherapy kills you, you can't sue them. Well, you'll be dead, but your family can't sue them because that's what was standard procedure. So they could kill a person using standard procedure, aka COVID, and you can't sue them because it was considered standard procedure. But if they do something out of standard procedure and bad things happen and you sue them, well, then they could be liable. So as long as they, kill you from a legal standpoint, then you can't do anything. Very sad, but this is the situation that we live in. I have not heard of artemisinin before. Could it be good for me as well? Well, a lot of things could be good for everybody. So you don't want to just be throwing everything at the wall either. So that did tests for you, but you don't want to be taking too many things. Again, don't just trust what I say. You need to be praying about your situation, what you should be doing. And there's wisdom in a multitude of counselors, and certainly the counselor of the Holy Spirit work in your heart. That's the greatest wisdom that you want to listen to. So be seeking a relationship with him more than anything else so that you can hear his still quiet voice telling you what to do and leading you in a certain way. June is my 2-year diagnosis anniversary. Breast cancer, 1B, no conventional therapies, no symptoms. Also, no idea if I'm getting better since I can still feel the tumor. Hate the idea of just waiting for symptoms of metastasis. I need to know if I'm beating this or not. Thinking of doing a PET scan to see if the tumor may be fibrotic or maybe see metastasis earlier. I don't think there's anything wrong with doing that. I've always said, don't do an invasive test just to satisfy your curiosity. But if you feel like God is leading you to do it, you haven't done any invasive tests, meaning that, okay, that's the radiation. But hey, I haven't done any other PET scans or CT scans. This would be my first. And you feel led to do it, then by all means do it. It's the accumulation of such radiation and things that are damaging to us, not just doing one or something. I have been squirting hydroperoxide on the open tumor in my throat. Should I use 30? It's 35% instead. 35% is pretty caustic. So I don't know that I would do that, no, because then you are swallowing it too. So I would not do that. I joined late. Did you see my answer? Answer my gross question. If so, I can wait. I did answer all your questions that I believe you got in within 10 minutes of this call starting. Have only had one MRI and didn't detox gadolinium well. Well, there's not going to be any gadolinium. It's totally different. So, I wouldn't be like, oh, I don't want to do a PET scan because I had a reaction to the gadolinium in a MRI. That is, doesn't mean that you're going to have a reaction to anything with the PET scan. So, gadolinium is a totally different ball of wax that people can have issues with. All right, thanks for being on the call. We've gone an hour here, so I think we'll end it here. Know that I'm praying for all of you, and we'll get this up right away. So if you had to get in late, then you can listen to it. All of my MRIs have been without gadolinium and have shown enough to be clear. It really depends on the oncologist and radiologist. Some will not do it, they just won't see it as well. Some, depending on the tumor, depending on what they're looking for, they're happy with what they can see. So you certainly do see more with a contrast. So, but if they're skilled, the radiologists can see without it as well. All right. Thank you guys much. I love you all. Till next week.